Hi, welcome back, students. Franklin University, HCM 830, Dr. D. We're just going to do a real quick overview of Unit 2. But before we do that, I want to thank you for all of your hard work in Unit 1. We had an opportunity to review some of the assignments. We had a live session this week. And so in Unit 2, we're going to continue on with the hard work that we're doing in Module 1. And under Unit 2, we're really looking at the healthcare system and the economic dimensions and how it differs from other countries, let's say Canada or Mexico here on our continent. Or, of course, there's been a lot of research on the Japanese delivery system and other types of systems. So part of what you're going to do is look at the key differences in the U.S. healthcare system that significantly higher cost, higher barriers to entry, such as education and training, compared to other countries. And so the synopsis of this unit, we will evaluate and analyze the cost of U.S. systems and why it's so much higher than other countries. And we'll evaluate what can be done to contain cost in the future. And if you just recall from our conversation just last week during our live session, how we talked about spending on healthcare is usually measured by the gross domestic product, which for all practical purposes is the total output of products and services of the United States, with a few exceptions, of course, and how healthcare spending is in upwards of 20% of the total expenditure. And again, compare that to your quote unquote household GDP. So if your total household earnings are $250,000 and 20% of that goes towards medical expenses, would that be sustainable for your family? Most likely not. And by extension, it certainly wouldn't be sustainable for the United States. Our job as professional doctorates is to bring those best practices from academia and from bench research to the clinics, to the hospitals at the point of service in order to reduce overall cost and, of course, improve overall outcomes. A lot of reading here in this particular modules, chapters 2, 3, 14, and 15 from Hicks. I would say particularly chapters 1, 2, and 3, make sure that you have a really good grasp of those concepts in chapters 1 through 3. I think you'll find that it will lay a good foundation for you for the rest of the course. You also have some peer-reviewed journals there, articles from peer-reviewed journals. Remember there, if you just click on the hyperlink of the actual title of the article, that article should appear for you. So I don't think you'll have any problems with that area. And then just to kind of recap what it is here that we're building on from let's say the first part of that module, for example, where we look at economic markets and how we determine consumers, and this is a rational consumer, how rational consumers make decisions based on the scarcity of their resources, and how we look for people to make decisions, economic decisions that are in the best interest of them personally and for their families. And really, that's what the science of economics is all about. There's two sessions, two quick concepts that I want to talk about that you'll do a deeper dive in here over the next couple of weeks, and that's the moral hazard and the adverse selection. So when we look at moral hazard, that is the behavior of someone that tends to be a little more riskier because they have insurance. So if we look at an example of, let's say, a smoker, uh, if the person does not have medical insurance, perhaps they don't smoke, or perhaps they don't smoke as many cigarettes or as many packs of cigarettes. And then all of a sudden they get some type of insurance, whether it's employer based insurance or maybe even public insurance. And the comfort of having that insurance thus changes the behavior of the consumer into more riskier behavior. So now all of a sudden, maybe they smoke more per day or smoke more packs per day. That's that moral hazard that affects economic decisions and irrational, depending on your critique of it. And then there's the adverse selection, which is the problems that's particularly associated with insurance and people that have chronic conditions. In order for insurance rates to be affordable, you have this creation of a risk pool. And in the risk pool, you have ideally younger, healthy patients and older patients that may have multiple chronic conditions. But because the risk pool is has enough people where the healthy people will balance out the cost of the sicker people, then the average cost of healthcare is lower for everyone in the risk pool. However, when we look at adverse selection and when we look at risk pools that don't have that same balance, then um, people with the people that are healthier tend to drop out of the risk pool. And the best example of that is with the Affordable Care Act, where you had young people that opted not to get health insurance and then just decided to pay the penalty when that penalty was a binding penalty. And so if we kind of want to take a look at it, when the healthier people drop out of the risk pool, the only people that are left in the risk pool are the sicker people with the multiple chronic conditions. And thus that increases the cost of healthcare as well. There's another concept, and I think we'll talk about it a little later on, but it's called provider induced demand. And this is where economists, and particularly executives in insurance companies, where the fear is that the provider, the medical provider, will pull or induce patients to show up at the clinic or show up at the hospital, in theory, for a position that isn't of a medical necessity, at least from the insurance company's perspective. So those are the three things. There's the moral hazard, where people that now have access to health insurance tend to exhibit and display riskier behavior compared to when they did not have health insurance. Then you've got the adverse selection, where in a perfect scenario, your risk pool is made up of both healthy and unhealthy patients, thus lowering the overall cost for everyone that participates in the pool. But when younger, healthier people pull out of the risk pool, then you are only left with patients that are sicker and have multiple conditions, thus adverse selection and raising cost of healthcare across the board. And then there's that provider-induced demand, which is, for all practical purposes, an artificial inducement or pulling of patients into the healthcare system for procedures and interventions that are not of a medical necessity, at least from the insurance company's perspective. So I think that's it. We don't have a live session this week. Our next live session is on the Monday, the 31st, at 7:30 Eastern time. So I look forward to connecting with you then. However, if you have any questions, comments, or concerns, please feel free to reach out to me and we can set up a one-on-one session if we need to connect before the live session. Thanks for your hard work, everyone, and I look forward to engaging with you over the course of the next week.